Acne is one of the most common skin conditions that we see. Everyone at some time in their life has some degree of acne. It's very variable. The main causes of acne are genetics, hormones, and also stress and medications can play a role in acne. We usually have a family history of acne when someone has fairly severe acne, and acne will start around puberty when the hormones start. And what happens in acne, hormones stimulate the oil gland to secrete oil. As the oil is secreted into the follicle, people who are genetically predisposed develop a very sticky, adherent scale that plugs up the pores. This causes the first lesion we see in acne called the comedone, which is the medical term for blackhead and whitehead. These plugged pores prevent the oil from leaving the follicle. Bacteria behind this plugged pore work on the oil, and then the follicle ruptures under the surface, causing a lot of inflammation, which makes you go from blackheads and whiteheads to little red bumps, bigger red bumps, pustules, nodules, cysts, the inflammatory lesions of acne. There are several treatments for acne, and we initially will start with the inciting cause of this abnormal scale formation by using topical medications derived from vitamin A to break up this abnormal scale formation that's plugging the pores. There are other topical medications we use to reduce the amount of bacteria in the skin as well. We also use oral antibiotics to decrease the amount of bacteria, which reduces the acne. As people go through life, acne, I always tell them, is kind of like the ocean. It comes in waves. And the goal of acne treatment is to have smaller waves further apart. I kind of refer to it as having lousy surfing conditions if we have really success with your acne treatment. And one of the realities of acne is that acne, since it's like the ocean and comes and goes, the treatments sometimes seem to work, sometimes don't seem to work. What you're looking for is, over a period of time, are you getting fewer breakouts, less severe breakouts, or not? We often have to change and modify the treatment during your time you have acne. Acne often goes on for several years. We can't predict when it's going to end. So whenever the treatment isn't working, we modify it and change it. We have lots of different options. There are certain situations where people have very severe acne with very large, painful cystic lesions, and there's an oral form of vitamin A that is remarkable in how successful it is, but there are some side effects and people need regular blood tests and monitoring in the course of that treatment. We treat acne so that while you have it, we can improve it so you look better, you feel better, and we can help prevent acne from affecting your self-esteem and self-confidence. But we also treat acne to prevent potential scarring, which can affect your self-esteem and self-confidence later on in life.